Thank you very much. Jordan?
Yes. So good afternoon. Thank you for the invitation to come to speak here today. My name is Jordan Laser. I'm a molecular pathologist from Northwell Health. It's a large health system in the New York metropolitan area. I'm also here representing the Association for Molecular Pathology as well. So the perspective that I was asked to talk about today is really in precision medicine oncology from a large healthcare system. Just a little bit about Northwell Health. We are 23 hospitals, over 450 physician practices, and we have a complete range of care from cradle to grave, from community hospitals to advanced academic tertiary centers. And similarly, we have the same experience in our oncology care. We do have kind of this mothership cancer institute. We have 3 satellite cancer centers scattered throughout what we cover geographically. And of course, then again, all the physician practices and the community settings. So when I think of clinical decision support and patient access, these are really 2 concepts that are almost inseparable. So much so that, and I appreciate some of the comments earlier today, that I always describe the clinical decision unit being both the provider and both the empowered and informed patient. If we were to boil down clinical decision support into its core, it is to provide that clinical decision unit with enough and sufficient and accurate information to be able to order the right test at the right time on the right patient. Now, Raman and Brian described kind of the holy grail, which I would love to see happen, where you have this active clinical decision support that's embedded in the EMRs. I think when we speak about that in the perspective of precision medicine and oncology and how much of it is based upon anatomic pathology data, we really do have a paucity of discrete data to be able to lean upon. And I'll be talking about that a little bit later. That said, you can still do clinical decision support. We have employed older school technologies or methods. We've leveraged the governance within our cancer institute. We have centers of excellences. These are disease team-based, interdisciplinary teams, where we have one for, say, lung cancer and one for breast cancer and hematologic malignancies. And of course, we have many committees in our cancer institute, and I have the privilege of chairing the Cancer Genomics Committee, where amongst many of our roles, one of our key roles is to create and vet clinical guidelines or clinical pathways. Of course, we take external resources, NCCN guidelines from professional societies, et cetera, but we also create many internally developed guidelines and standards of care for ourselves. Now, having those guidelines is fine and dandy, but of course you need to then distribute them and educate all the providers on and how to use them. And therefore, we actually employ passive clinical decision support methods. We publish these guidelines on our cancer intranet. We distribute them down back through our centers of excellence and our pathology services, and we also have passive links within our EMRs. I think it'd be remiss if I also didn't discuss the reimbursement and regulation, how it impacts clinical decision support and patient access. And I really do empathize with both the providers and the patients who are frequently in the position where, on one hand, they have their professional societies, precision medicine initiatives, really touting the excitement and the benefits of precision medicine. And then on the other side, they're frequently challenged with payers. Someone had mentioned the CMS's national coverage determination earlier today, and also the regulators and that with, for example, FDA regulating or oversight of laboratory developed tests. And again, I really do empathize with them because the provider and the patient are sitting there together trying to make decisions. And there's a tremendous amount of uncertainty. And sometimes it's actually been described to me as a paralytic uncertainty. So when I think about next steps and challenges to overcome, I think as pathology continues on its journey towards quantitative pathology, particularly quantitative anatomic pathology, we need to figure out ways to create and document discrete anatomic pathology data. I think we need to, of course, measure, learn from that data, and feed it back into the system. and also call for better alignment between the influential organizations in precision medicine, again, particularly the professional societies, pharma, payers, and the regulators. So thank you.